Unfortunately, like so many things with this pandemic and with so many other health and disaster related issues, is it's uneven. It's uneven because it's driven by the inequalities that existed even long before COVID-19 entered the global stage. Countries with access, countries with the ability to purchase vaccine, to distribute vaccine, with the infrastructure for which to moving it around. But then you layer on top of that a lot of unevenness in terms of which vaccines are available. Now, hopefully this will start to level out a little bit, getting the attention that it needs to help to even this out, as well as more vaccines become available. But even the logistical challenges associated with some vaccines is very different associated with others. But unfortunately, this unevenness and this lack of access in poorer areas is something that is very predictable and something that we see time and time again. We're good at measuring it, not very good at keeping it from happening.
Yeah, we saw it coming. And we know that the WHO has the COVAX program specifically to help move vaccines to poor and developing countries. What is the status of that program, in your opinion? Do you think it's working?
I think the COVAX model is very interesting in terms of it being developed. I'm not versed enough to really say, it's how great it's going so far, but as a model of sort of pooling resources globally and creating a more even playing field is certainly something that can certainly help to offset some of the inequalities that would go from just an every nation for themselves type of approach. But seeing how that plays out as more vaccines come on the market and which countries are able to subsidize that and which countries are actually receiving the vaccine and how that's being distributed within the countries themselves, if it's truly reaching the most vulnerable populations, is something that we need to be continuously vigilant about and making sure that we are working more towards equity.